The kind of people that come in for the consultation, they're generally about 40% males and 60% females. I mean, everybody wants to look good, and the way we look good, particularly out there in the world, whether in business sense or just on a personal level, I mean, the first thing that you look at is you look at the eyes.
My eyes would droop, especially the left eye. I had tremendous fat over the upper eyelid. If I look in a mirror, I look tired.
So we found Dr. Walman. His credentials and his background gave us confidence that this would be a really good fit. And when we had our consult, we really felt comfortable and, excited.
The eyelid lift, or the blepharoplasty, we refer to it as a laser blepharoplasty because the key to the procedure, the way we do it, involves the use of the laser.
If I could have the procedure and it was available, why not? Because it has made a huge difference.
As we age, gravity kind of does that thing on us, and those eyelids tend to start sinking down a little bit. We tend to have more skin. We tend to have excess skin that's around the eyelids, and this gets bothersome from just a cosmetic standpoint and a functional standpoint.
My eyes are open without me making an effort to keep them open.
The laser actually cauterizes those blood vessels, so there is much less in the way of the bruising or bleeding afterwards. And yes, there is a little bit of swelling afterwards, but really that little bit of minor swelling is really limited to below the brow and above the lashes, as opposed to having these raccoon eyes that you have to deal with afterwards. So the recovery afterwards is easier and faster. During the procedure, it is a local anesthetic so that we avoid any of the side effects of a general anesthetic, and that's also important to people because we want them to get back to their normal activities without hindering them. Our priority is the health of the eyes. And that, by the way, is a reason why a lot of people will come to see us. I mean, people will ask me the question, well, why shouldn't my plastic surgeon that's done all sorts of other work do that sort of work? And my response generally is, well, I have utmost respect for my plastic surgeon colleagues, I really do. And that is when it comes to doing things like tummy tucks or facelifts or that sort of thing. But when we get to the topic of eyes and eyelids, I get rather territorial about that. Again, the emphasis is about the health of the eyes. And if you're going to do something about those eyelids, you really want to focus in on having somebody that's experienced in eyes, number one, and secondly, you want to have somebody that's experienced at doing it with the laser. Those are two important aspects and why a lot of people come in to see us.
The way I looked at it, it was an ophthalmologist. Since they're doing the procedure, they're going to be very careful with the eyes.